So we are officially 2 decades into the patient safety movement. As Monday morning quarterbacks, what have been the field's biggest successes, and what would you have done differently?
So, I think some of the biggest successes are really the fact that, patient safety has gone from being something that people were not even aware of, we're not talking about, we're not transparent about. 20 years ago, people didn't even really acknowledge that errors occurred. And over the last 20 years, that has completely shifted, where now it's an accepted thing that we have medical errors and safety issues, and leaders are transparently talking about it. We have ways to measure it. We have ways to, real strategies around things like high reliability, et cetera, to try to drive improvement. We're measuring culture, which we weren't doing. We're training and educating, et cetera. So a lot of things have happened, which I think is important to note, that it has only really been 20 years, and we didn't expect to have solved the problem of patient safety in that time, and we have made a lot of progress. Now, that being said, I think, in your Monday morning quarterback thing, there certainly are lots of things that I think we could do differently or better. I think one of the things that we still continuously struggle with is that leadership and culture piece, and sort of ensuring that this is top of mind for our leaders in healthcare, despite a lot of other competing priorities. And I think we've struggled with that. I think the issue of workforce safety was not really prominent 20 years ago, and that linkage that workforce safety is essential for patient safety was not something that we really were talking about until very recently, yet I think was a really important underlying foundational driver that we should have probably been talking about much earlier. And then the last thing I'll mention, I'm sure Jeff has tons to add, is, we really started out thinking about this in hospitals, and now finally we're really broadening that out to say the entire continuum of care. But it would have been, as a Monday morning quarterback, it would have been nice if we had really been thinking across the entire care continuum from the start, because we know there's lots of harm happening outside of hospitals. So that's I'll start with that and see what Jeff wants to add.
Yeah, that's great. It's nice. It's been really nice working with Dr. Gandhi and the entire committee, because I think the shared thinking that we all have is really representative of I think some of the progress that we've made. There's a lot of common thinking, and I think that has come about as a result of a lot of hard work, quite frankly. One of the things looking back, I think it's a matter of the level of attention and resources that we put on safety relative to how much of a concern it is, how much harm is actually still happening. And so I think those things are coming closer to matching, I guess, to a level of investment and resources and attention, time. Those are probably the most valuable resources, time and attention. So I think those are, we're making progress in terms of recognition of how big the problem is and what needs to be done to solve it. I think another thing is recognition that there's really not one organization that can do this alone, that coordination is critically needed. Healthcare is so complex, so it shouldn't be any surprise that patient safety issues are similarly complex. They are happening in healthcare. And so in a lot of cases, organizations are responsible for, they have a role in parts of the problem. And so that very clearly, I think those of us who work in safety time and time again, and even the frontline clinicians who work in healthcare, there's clear recognition that more coordination is possible. And that's definitely a key feature of the National Action Plan that we have drafted. I think, in terms of AHRQ specifically, that's where I work, and thankfully we represent, I think, a fair amount of the progress that has been made. Again, of course, working with lots of folks, we absolutely did not do this alone, but we are proud of some of the contributions that we've made in the field, things like healthcare-associated infection prevention, along with organizations like the CDC, many others. But I think we've made really good strides there. And looking back on that success, I think it's impressive to me that we've not only made the actual progress on those individual problems, but we've learned how to solve other problems. So I think that's representative of where we are in terms of progress right now, is trying to apply some of those lessons learned. Uh, for example, from HAIs and other areas, medication safety medication safety events is another area. And so that's what kind of keeps me positive that we still have some good lessons to apply and learn. And those are represented in programs like the Comprehensive Unit-Based Safety Program, CUSP. I think we've really worked hard to adapt that in a thoughtful way to problems beyond healthcare associated infections. And I think, probably the last thing I would say is that, along with this increased awareness and recognition, there's less and less tolerance for error. I mean, that's what motivates people, is when they see a problem and they appreciate it more, that it is a problem and the impact that it causes. And nobody likes this, right? Nobody should like this. These are bad things that happen that nobody wants to happen, yet they still do. And I think that energy motivates people to do more. So yeah, I think we're really eager and excited to share what we've pulled together with this group, and hopefully use that to continue the progress that we've seen so far.